Richard Graham.
Number one, please.
Prime Minister.
Mr. Speaker, may I start by commending the Together initiative for organising this coming Sunday what will hopefully be the nation's biggest ever thank you day to mark the birthday of the NHS. It will provide the perfect moment to thank not just our amazing NHS and care workers, but also those key workers who have helped in the national effort throughout our fight against coronavirus, and indeed all those across the country who have gone the extra mile for their local communities in these challenging times. I'm sure we can agree across this House that the NHS represents the very best of us and that we will always be there to support it. Mr. Speaker, this morning I had meetings with ministerial colleagues and others. In addition to my duties in this House, I shall have further such meetings later today.
Richard Graham.
Mr. Speaker, as the Prime Minister says, today is the 72nd anniversary of the NHS and a good moment for us all to appreciate the immense role of the NHS in all our constituencies, perhaps especially the Gloucestershire Royal Hospital, which has put up with me as a summer volunteer for the last 10 years. Mr. Speaker, the Prime Minister's launch of the UK New Deal yesterday paves the way for exciting new projects. Can I highlight for his attention the proposed Eco Park and Green Energy Park in Gloucester, which may need a little of the Chancellor's oil? And can I also highlight, should it be approved, the shovel-ready new Gloucester to Cheltenham cycleway, which I hope that he might accept an invitation to come and open with my honourable friend for Cheltenham and I when it is ready.
Mr. Speaker, I thank my honourable friend very much for that question, and I congratulate him on what he's doing to support the wonderful new Eco and Green Energy Park, and I look forward to joining him on the new cycleway in due course.
We now can Right Honourable Sir Keir Starmer, Leader of the Opposition.
Thank you, Mr. Speaker. Can I too celebrate the birthday of the NHS, as we all will, this Sunday, particularly at this time? Mr. Speaker, at the daily press conference on the 18th of June, the Health Secretary said there's an outbreak of COVID-19 right now in parts of Leicester. Yet it was only on Monday evening this week that the government introduced restrictions. That's a delay of 11 days, during which the virus was spreading in Leicester. Why was the government so slow to act?
Prime Minister.
Well, actually, Mr. Speaker, the government first took notice and acted on what was going on in Leicester on the 8th of June, because we could see that there was an issue there. We sent mobile testing units, formal mobile testing units, shortly thereafter. We engaged actively with the authorities in Leicester, with public health in Leicester, with everybody responsible in Leicester, in the way that we've done with other areas that have had similar issues. Unfortunately, in Leicester, it did not prove possible to get the results that we've seen elsewhere. So on Monday, we took the decision which I hope the Right Honourable Gentleman approves of, to go into lockdown in Leicester, because I've been absolutely clear with the House and with the country that we are going forward. We've made huge progress, but where necessary, we will put on the brakes. We acted decisively, and I think it was the right thing to do.
Keir Starmer.
Mr. Speaker, I do support the government's decision of Monday, but I think the 4,000 businesses and the 160 schools that are now shut might take some persuading that the government acted quickly enough. One of the problems in Leicester was the local authority only had half of the data. They had data for Pillar 1 COVID tests. That's NHS, care workers and tests in hospitals. They didn't have Pillar 2 tests, the wider tests in the community. Now, that may sound technical, but what that meant was that the local authority thought there were 80 positive tests in the last fortnight, when the real figure was 944. The local authority was only given the real figure last Thursday. So there was a lost week whilst the virus was spreading. There are now real fears, Mr. Speaker, of further local lockdowns across the country. Can the Prime Minister give a cast-iron guarantee today that no other local authority will ever be put in that position again?
Prime Minister.
Well, actually, Mr. Speaker, I'm afraid the Right Honourable Gentleman is mistaken, because both Pillar 1 and Pillar 2 data have been shared not just with Leicester but with all authorities, Mr. Speaker, across across the country. And we did in Leicester exactly what we did, for instance, Mr. Speaker, in Kirklees, or in Bradford, or in Weston-super-Mare, or other places where very effective whack-a-mole strategies have been put in place, for reasons that I think the House will probably understand. There were particular problems in Leicester in implementing the advice and getting people to understand what was necessary to do. But let's face it, we've had to act. The government has acted, and he wants to know whether we'll act in future, Mr. Speaker, to ensure that we protect the health of the entire country. And I can tell him that we will. Absolutely, Mr. Speaker.
Keir Starmer.
Mr. Speaker, I spoke to the Mayor of Leicester this morning, and I know the Prime Minister spoke to him yesterday, and it is absolutely clear that he didn't get that data till last Thursday. I doubt he told the Prime Minister something different yesterday. The Prime Minister can't just bat away challenge. These are matters of life and death and the people's livelihoods. An example of this, Mr. Speaker, last week, the member for Hove asked the Prime Minister, how can seaside towns be expected to cope with likely influx of visitors to beaches and parks during the hot weather? The Prime Minister replied, show some guts. 2 days later, Bournemouth Beach was closed with 500,000 visitors. A major incident was declared. Does the Prime Minister now regret being so flippant?
Prime Minister.
I really think that the right honourable gentleman does not distinguish himself by his question, because I was making it absolutely clear that as we go forward with our plan, our cautious plan for opening up the economy, it is very, very important that people who do represent seaside communities, places where UK tourists will want to go, should be as welcoming as they can possibly be. That was the message I think is important to set out. But it is also vital that people have to behave responsibly. Yeah. And that is why the scenes in Bournemouth were completely unacceptable, and that is why we stick to the advice that we have given. And I made it absolutely clear that people, if they're going to travel to the seaside, if they're going to take advantage of the easing of the lockdown, then they must observe social distancing, and it is everybody's responsibility to ensure that is the case.
Yeah. Keir Starmer.
Mr. Speaker, the Prime Minister must understand why this is of such concern. There's nationwide lifting of restrictions this weekend. Without an app, without clear data for local authorities, or the world-beating system we were promised. Last week, I do support it, but I'm not blind. I support the easing of restrictions, but unlike the Prime Minister, I'm not blind to the risks. And I don't think anybody else should be. Two-thirds. Last week, I pointed out to the Prime Minister that two-thirds of people with COVID-19 are not being reached and asked to provide their contact details. The Prime Minister typically said it was all a stunning success. The updated figures now show that things have got worse. Of the 22,000 new cases of COVID infections per week in mid-June, just 5,000 were reached and asked to provide details. So now three-quarters of people with COVID-19 are not being reached. How does the Prime Minister explain that?
Prime Minister.
Mr. Speaker, as he knows very well, the test, track and trace operation is actually reaching huge numbers of people and causing them to self-isolate in ways that I don't think he conceivably could have expected a month ago when this system was set up. It has now reached 113,000 contacts, 113,000 contacts who have undertaken to self-isolate to stop the disease spreading. And that is why we're now seeing the number of diseases, the number of new infections come down for several days running now to below 1,000. The number of deaths continues to come down. And that is a great achievement on the part of the entire population and their willingness to support test and trace.
Keir Starmer.
Mr. Speaker, if the Prime Minister can't see that if three-quarters of those with COVID-19 are not being contacted and asked for their own contacts, that is a real gap in the system. You can't just brush it away by referencing those that are contacted. It's a real problem and it's growing and it's going to have to be addressed. The Prime Minister did this at phase one, brushing away serious concerns. I want to turn to the Prime Minister's speech yesterday, if I may, Mr. Speaker. Amid the normal bluster, there was a really striking line in that speech. The Prime Minister said, "We know that the jobs many people had in January are not coming back. I fear that this is the equivalent line to the line in the Prime Minister's speech of March the 12th, when he said, "I must level with you. Many more families are going to lose loved ones before their time." And we know what happened next. That's why there needs to be a laser-like focus on protecting jobs. So how many jobs does the Prime Minister think yesterday's announcement will protect?
Prime Minister.
Mr. Speaker, I think he first of all might pay tribute to the work of this government in protecting 11 million jobs throughout this crisis. He might draw attention to the fact that we've supported huge sectors of the UK economy at a cost of £120 billion. And I'm not going to give a figure for the number of job losses that may or may not take place, but of course the risk is very, very serious, as he rightly says. But that is why we're proceeding with the new deal, the fair deal for the British people, which will be not just massive investment in our National Health Service, £34 billion in our NHS, £14 billion more into our schools, but an investment in infrastructure going up to £100 billion. That we are going to build and deliver jobs for the people of this country.
Keir Starmer.
The reality is, Mr. Speaker, that the Prime Minister's announcement yesterday was investment equivalent to less than £100 per person across the United Kingdom, 0.2% of GDP. Not much of his announcement was new, and it certainly wasn't much of a deal. Meanwhile, as the Prime Minister was speaking, Airbus announced 1,700 job losses, EasyJet 1,300 job losses, TM Lewin and Harvest 800 job losses. That's just yesterday. And there was nothing in the Prime Minister's speech for the 3.2 million people in hospitality or the 2.9 million in retail. Next week's financial statement could be the last chance to save millions of jobs. Will the Prime Minister start now by extending the furlough scheme for those parts of the economy that are still most at risk?
Prime Minister.
Mr. Speaker, let me just repeat and remind the House that overall this package represents a £600 billion package of investment in the UK economy. But the best single thing we can do is get our economy back to health by getting our people back into work and getting the virus defeated and under control. And the best thing, actually, that the opposition could do is stop equivocating and doing one thing one week and one thing another week this week, and decide that they emphatically support ending the lockdown. And they emphatically support kids being back in school rather than being bossed around by the unions. Mr. Speaker, we are the builders, they're the blockers, we're the doers, they're the ditherers. We're going to get on with it and take this country forward.
Andrew Bowie.